we'll talk about this. Now, understand that we all have different ways of treating periodontitis. I know you have your way and I have my way. I'm not going to make a point as to whether one is better than the other. I am going to make the point that there are ways in which we can differentiate ourselves and be different from other people. So I want you to look at this and see how you can apply it to the particular technique that you use. So let's look at this case. Okay, this is a 37-year-old male. He presents with a complaint of bad breath, bleeding gums, and he's had an examination with a periodontist who told him he needed surgical treatment. Okay, the examination shows significant periodontal pockets, gingival redness, and the appearance of an aggressive periodontitis. So let's take a look at him now. We'll see what he looks like. You'll get an idea that there is gingival redness right here, some gingival redness here. You know, it's not necessarily, it doesn't look bad, at least it doesn't look bad to what we're seeing, but don't forget the complaint of bad breath. That's going to bother him. That's bothering his girlfriend. He's here because of his girlfriend. And he's also getting periodontal advice and seeing us for a second opinion because of the smell. I mean, it's really the smell that's bugging him. So, same picture with the mouth open just a little bit. You can get an idea as to what's going on. Now, we take a look at the radiographs, and you can see what's going on here. You can see the amount of bone loss that's present on the mesial of tooth number 11. You can see the generalized bone loss. You can see in all of these areas here in the lower anterior region. You know, for a 37-year-old, this is pretty bad. Do you agree? Okay. Let's go on to the next. So here's the periodontal probing that we see, and you can get an idea as to what's going on. This is the facial, this is the lingual, and you can see a 7mm pocket in the straight lingual of number 11. A deep overbite case, and tell me what's going to happen with canine guidance with that kind of a defect on the lingual of tooth number 11. Okay, that's putting an awful lot of strain on the facial bone, and how thick is the facial bone overlying tooth number 11? Get the picture. Now, we're not going to adjust the occlusion at all, but you can see how the occlusion would be involved here. And what happens is that patient loses that canine tooth with the depth of the overbite, with the amount of bone loss that's present in the lower incisors. This can be pretty devastating. Okay? So as you look across here, notice circumferential type of defect, likely on the lingual aspect of tooth number 18. We go across here, you can see a great deal of bone loss. Now, I want to talk to you about something that's really important here, and that is the oral DNA test. The oral DNA test is one that allows us to be more like doctors. You know, we can be more like doctors because now we're doing things that doctors do. You know, physical examination is very, very important in Europe. In the United States, people get printouts, they get charts. And we found the oral DNA test to be one of those charts that's not only very accurate, it's also sales-worthy. Because if you take a look at the high-risk pathogens, it's very well identified. Moderate-risk pathogens, well identified. You've got your threshold, and there's the threshold. If you're above the threshold, then you're in trouble. Very easy for a patient to be able to see this. In addition, we've got metronidazole right here as the suggested antibiotic based on this distribution of bugs. So, essentially what I'm recommending and recommending to the patient is let's get an oral DNA test to find out what bugs are growing there. All you need to do is spit in a cup. We'll send this out to the lab. The laboratory will come back with this particular report. Does that differentiate me from what the last periodontist did? Absolutely. The last periodontist didn't look at identifying the bacteria. That makes sense to the patient. So now the patient isn't just getting another opinion of what should be done, they're getting another opinion with regard to diagnosis and how important is diagnosis to everything we do. Remember, we're talking about diagnostician first before rendering treatment. And this allows the patient to have an additional method of diagnosis that's never been recommended before. And I told the patient, if we find out that there's some pretty aggressive bugs, and by the way, some of these bugs can be related to heart disease. In fact, once we had those, have that chart, we can see the high-risk pathogens are often related to heart disease in the future, or could be related to heart disease in the future. Now we have a piece of proof on the paper. It isn't just a pocket. It isn't just something the periodontist told the patient he needed. It's actually something that's identified in the laboratory as being a high-risk pathogen. Okay, the treatment that we're going to do is an EOPT4. That's perioscopy. That's 4 visits. We do it all at one time. Once the patient's in the office, we will do all of the treatment at one time. It's about a 3-hour visit, a little bit more than 3 hours. Patient will be numb, full mouth, with our hygienist, and go below the gum line with a perioscope and get the root surfaces cleaned under the antibiotic therapy if it's recommended. And then there'll be a reevaluation. So during this time, when I'm explaining to the patient what's going on, you've got an aggressive disease. This disease is going to cause you to lose your teeth. The reason that you are getting the smell is because there's bacteria well below the gum line that's causing that smell. So we've got to get rid of that infection. And at that point, I say, in order to be able to identify what's growing there, I want you to spit into a cup, and I want to send out the saliva sample to a laboratory so I can see what bacteria is growing there. We don't have the oral DNA test at this point. This isn't what's occurring when we're asking the patient for acceptance of treatment. There's sometimes I'll run the oral DNA test and have the patient come back after antibiotic therapy to see if there's any progress before we do any treatment. But for the most part, I want to identify the bacteria because I want the antibiotic assist, if necessary, in an aggressive case before we instrument. That can make a tremendous difference for patients. So go on with the script. This will cause you to lose your teeth. If we get this bacteria under control, if we get this disease under control, we have a very good chance of saving your teeth. I've seen a lot of cases like this before. You're 37 years old. Now, there's certain things that you need to do in order to be able to get things under control. And I may then go into the diet history. I don't do a 5-day diet history. I'll ask the patient, what have you eaten and drunk in the past 24 hours? Let the patient then come up with a list. Now, I might have to coax them a little bit. All right, what'd you have for breakfast this morning? Okay, did you have anything before you came over here? All right, what about last night? What about before you went to bed? And the patient will then list off the things that he or she has eaten or had to drink. What do we find out from that? We find out the amount of sugar that the patient's having. Because the patient eats a lot of sugar, we know the patient's inflammation is going to go up, and resistance to care is also going to go down. We also can find out whether the patient is eating a lot of fruits and vegetables. Because we know, according to the American Heart Association, the American Cancer Society, the patient anybody should be eating 7 to 13 fruits and vegetables per day. That might sound like a little bit like a lot to you, but that's actually what comes out from if you go to the American Cancer Society website, you'll see that. American Heart Association has the same thing. And those of you who attended the lecture that I gave at the AAP saw the backup data for that particular statement. So now we're getting the patient into a healthy mode. We're not concentrating on money at this point. We're concentrating on health, the fact that bacteria may be related to diseases that are far away from the mouth, that you may lose your teeth. And by the way, we want to make sure that you're eating healthy because we want to make sure that you can increase your resistance. You see, all of these things are now the things that a patient is thinking about, not the money. I may lose my teeth, maybe part of it, and there might be even more things that we can talk about, not just giving you all 4 things that we're talking about here. So I'm doing that presentation, that's what I'm saying, in front of the patient. And I said Danielle's going to talk about this with you a little bit in the other room. Before I go, are there any questions you might have? If the patient asks me a question, I'll answer it. If the patient asks a question that Danielle can answer,
then I answer. I was waiting for you to comment. Yes, correct. I always tell Dr. Sheldon, do not be the one that tells the patient he's not going to answer the question, because it doesn't sound very good. They feel like he's shoving them off and trying to get to the next room. So as soon as the patient does, as soon as the answer, something comes up that I can't answer, I say, I'm going to spend some time with you. We're going to go over that stuff, but if you have anything else for him that I can answer, go on ahead and ask that now. And they'll usually say, no, I do have some questions for you, but no, I don't have any more.
Okay, so then you bring them back in the financial arrangements. So this allows me to get out of the operatory. Really, if I can give the overview and go through this very quickly, then this gives me the overview, and Danielle can bring the patient back into the financial arrangements room.
Right. And when I'm in the financial arrangement room, I bring back up all the stuff that Dr. Sheldon was just showing you, because these tools are real. They're real things that I can show a patient that he can understand and see, because for this patient in particular, he didn't have a gross mouth. He didn't have stuff inside his mouth that I can show you, hey, look at all this plaque that you have.
But if you have a microscope, and I know somebody out there does, I know, Bill, you have a microscope, you can show them you can show them the bacteria right there, and it's really neat.
Right, and it's the same thing. They need proof. These patients are they're afraid that you're going to tell them they have something they don't have. They want proof. They want to see this stuff. And for this guy, he looks in the mirror and smiles. He doesn't have a bad mouth, but what he does have is he does have other symptoms. So I take him into the room and I show him the perio charting. I show him those red lines. I show him the x-rays. I show him the missing bone. I show him the oral DNA that shows a graph. It shows bars of that he's over a line. That these are tests. These are probings that we've come up with. These are x-rays that are his, and these are tests that came from a bottle that he has spit into. So I show him this, and then I say to him, listen, you're 37 years old. You're younger than I am. You're 37 years old. You're a good-looking guy. You are way too young to have dentures. And for this is a disease that doesn't go away. It can be controlled, and it can get a lot better, but it won't go away. It's like having heart disease or diabetes. It's in your DNA. It's something you're always going to have to deal with. So we have to not clean the teeth and send you away. We have to show you how to prevent this from continuing to eat the bone, loosen the teeth, and eventually take your teeth away. So I'll use the analogy of heart disease. If you go in for a bypass surgery, they're not going to do your bypass and not tell you how to live differently to prevent this from coming back again. They want to increase your longevity. They want to show you that you are doing things in your life, maybe something that somebody else is doing that's close to you, but you can't do it because this is in your DNA. So usually if there's something going on with your body, your teeth, your body, it's a deficiency, and it results in symptoms. And you can't ignore those symptoms. His symptoms happen to be bad breath, bleeding gums, and that was his symptom. So there's something going on. He doesn't think it's this bad. So as we're going over showing him all these numbers that are pretty severe, and we're talking about dentures and teeth falling out, it becomes a lot for him. So I need to show him that evidence to say, look, TJ, this is you. All this is you and your results. So I tell him it's not going to get any worse. It's not going to get any better. It's only going to continue to get worse if we don't do something about it. He has loose teeth. He has the data in front of him. And I show him that we have a program. We don't have something we're going to sell him and then shove him out the door. We have a program. And this program is created by Dr. Sheldon to improve his pockets, to make these teeth strong again, to prevent him from getting into dentures. It's a program that will show him what he's doing right now, how to get better and prevent this disease from taking his teeth away. One is going to be the 4-hour replanning. That we do. We do that with endoscopic camera. We find all this calculus, all this disease, we clean it out, we do that. And then his part is going to be what he's going to do at home, supplements he's going to start taking, things he's going to stop eating, ways of taking better care of his body that will help this from reoccurring, as well as recall visits in our office for the rest of his life. I will then go over some success stories of past patients like TJ. We had a patient that was actually younger than TJ. I believe he was 34 years old, Mark from Tampa. Mark from Tampa came over, younger than this, good-looking guy, that was told by a few different people that he needed to have all of his teeth taken out and full dentures. And Mark did the program with us. Mark got better. I think he only had one molar tooth, or maybe two extracted, and he didn't have to get a denture. So he had a wonderful result. Same exact type of case. So I share that with TJ so he understands that we see patients like him, even more severe, that have overcome just by doing the program. So we'll go over for TJ. You have to understand that he does not get that it's not okay to eat all that sugar. That because his defense is these energy drinks that he's drinking, they have vitamins and minerals in them. The Nutri-Grain bar he has for breakfast has a lot of nutrition in them. That these things that he's eating have these false labels on them that's making him think he's doing the right thing, and he's not. So it doesn't matter if you're TJ at 37 or you're Betty at 85. They lived their whole life like this, and they don't know how to eat right. They don't know how to brush their teeth right. So with this regimen that we put them on, we show them. And so when I'm in the financial room with them, I say, listen, this program that I'm showing you is $3,800. But this is not going to clean your teeth for 4 hours. We are going to use an endoscopic camera. We're going to non-surgically go below your gum lines. We're not going to cut anything. And we're going to clean out all that disease and make it clean. We're going to show you with visits to our office, we're going to show you how to eat right, take the right supplements, and do the correct home care so you can prevent this from coming back again. Because paying $3,800 is not a big deal if you do it one time. Of course it's become a problem if you're doing it over and over and over again. But if you come back to our office for these recalls, we will keep this disease free from you.
Okay, so let's answer a couple of questions. Number one, and that Bill Neal, you're asking about the oral DNA test. You and Bill, you do use microscope on everybody. I don't know that. I wouldn't discourage anybody from using the microscope. I think it's great. I think there are certain diagnostic tools that, if we're really good at reading the microscope, it might be able to help. But we all know that the microscope will not help us identify the 11 different periodontal pathogens. So that would be the reason I go to the oral DNA test. But I've still considered, I had a microscope at one time, and finally I stopped using it, and so I don't use it anymore. But as you and Tom and others who use the microscope on a regular basis know, I've been considering bringing it back. But right now the oral DNA test does what I wanted to do, so I'm fine. And the question from Mindy and Michelle, and the question was, what's EAPT? That's endoscopically assisted periodontal therapy. EAPT, endoscopically assisted periodontal therapy. 4 means that's the number of visits that we need, and that ends up being the number of hours that we need, because when we're seeing a patient, we try to get all of the treatment done all in one long visit if we possibly can. So thanks for asking those questions. All right, so now let's assume the patient says to you, well, $3,800 is a lot of money. How can I pay for this?
Well, I do have a few different options for you here to pay. The first option I have is Care Credit. Care Credit is a great finance company that most of our patients do use because it does offer comfortable payments. It has a 12-month interest-free option, which is great because for a whole year you can make those payments without any interest whatsoever. If you want lower payments, you can have interest-bearing financing done that will add interest to this, but it will give you a much lower monthly payment. If you don't want to do financing and you have a way of paying for this on your own, we do offer a 5% discount for anybody who wants to prepay. So you can use a credit card, check, cash, however you want. You can pay that today, and we can go ahead and get you scheduled, and you can save 5% on that, which is a very nice one because gas prices are going up, things are going up. So it's a great savings if you already have a way of paying. Also, if you have something with Sky Miles or cash back on your card, it's a great time to use that as well. If you don't want to do either one of those, then you just pay the amount 2 weeks prior to the visit, and you just prepay that 2 weeks before, which will confirm that appointment and keep you on the schedule. So which one of those works better for you?
Well, all of it sounds okay, but let me give you a hard time. So,
Sure.
What can I just do part of it now?
Well, you can do part of it now. We can start, if you want to break it up into two-hour visits, we can do that, and you can pay for those at a time. We're not going to recommend that you go too far. You can't wait a year in between. You can wait 6 weeks or so in between each one and do it that way. But for something this aggressive, these pockets are not getting any better. If you wait too long, you're going to invest half the money into doing the upper and have a blown out case because you're still having that bacteria in your mouth. You're still living with all that. It's not a great idea. For something like this, for one, you don't want to have this in your mouth at all. You've had it in there too long. So let's find a way for you to pay for the whole thing and get it done so you can get on just regular cleaning regimens and have a healthy mouth.
All right, well, I think I already qualified for care credit, so I think I'll do it that way.
Okay, that's a great way of doing it. You can do the interest-free for 12 months or the interest-bearing. So let me pull up your amounts here so you can find a monthly payment that works best for you.
All right, good. Okay, so now the patient accepts treatment.
Right.
Now begins the program, and I'm going to emphasize program. This isn't route planning by quadrant, and we charge for the quadrant. Frankly, when we start to get in competition with the general dentist, we're going to get in trouble because they're always cheaper than we are, aren't they? And we found the same thing. Even though we had the perioscope, we found that even with the perioscope, patients couldn't differentiate. The scope was nice, or they kind of got the idea of what a scope was, but they really didn't know. But as soon as we started setting up a program, and then I made a 12-minute video on YouTube at 10:30 at night on a Sunday night, and just talked to the patient about what disease he or she has, how that bacteria can be devastating not just to your teeth but to other things, and that in fact we're going to put you on a program, and it's going to be a program that's not just related to the teeth, but it's going to be related to your overall health as well, because this in fact shows you have a weakness in your health. All of a sudden, by putting it into a comprehensive program, we weren't competing with the general dentist anymore. We were doing something different. We're doing something far better. And rather than our acceptance rate going down because we added $1,000 onto the program, our acceptance rate went up because we were different from everyone else. Not just the perioscope, but also being concerned and having a program to help that patient with his or her overall health.
Well, usually the patients that are coming in for this have a secondary condition. They have diabetes, they have high blood pressure, they're overweight, they have a skin disorder, something else is going on with this as well. So having this, and I tell them, you're having some symptoms in your mouth, you're having other symptoms as well. So adding supplements, changing your diet, becoming active, doing these things it's an overall body improvement. So they always come back, and I share those stories. These patients that come back and they lose weight. Patients that come back and say, I was able to lower my blood pressure medication or my diabetes medication, or even get off of them. These are great things. Just because you're having symptoms in your mouth doesn't mean it's the only thing that's going on.
Yeah.
So yeah, the patients are very thankful. They're very grateful. Don't get me wrong. We still have the people that give us a hard time. But, you're going to have patients like that. But the larger percentage of our patients love this program, and they're so thankful that we have helped them, because I also share stories of patients that come to us that have been to corporate offices or other offices and said, I had that done last year, I had that done 2 years ago. We don't have patients that say that, because as long as they're staying with our recalls and we're able to, they're sticking with us, they don't have this done for a second time.
So good. Ryan, to answer your question, the turnaround time for the oral DNA test is about a week. And essentially, they'll provide us with a package. They spit the cup.
Yep.
We send it out.
Right.
They provide the mailer and
Correct.
everything.
Yep.
And then
Very easy.
they will contact us by email, will they not?
They email us the results, correct.
Okay. Yeah.
Yeah, so it's very easy. Also, if you have patients that are barking at the cost of this root planing, this program, it's a good time to share with them the cost of an implant or the cost of full extraction and dentures, because it's way more than what this costs here.
Good. Okay. So during this program also involves working with one of our dental assistants who's going to follow up the patient and instruct the patient in oral hygiene and also go over diet. And so we have this little problem list. What do you call it?
It's our EAPT oral hygiene checklist. We pull it every time the patients come back, so we are sure to ask the same questions and to record the same answers, improvements, or whatever it is.
Okay, so you can see the three different questions. It's three different sections. Patients reported their daily oral hygiene regimen, so it's essentially what they're doing at home, and then the assistant determines what's found and the changes that should be made. Next part is diet. And the third part is the supplements that we might recommend. And we do recommend supplements. Juice Plus is one of those supplements that we routinely recommend, because Juice Plus is concentrated fruits and vegetables in a capsule. We recommend that highly. There's 31 peer-reviewed studies now on Juice Plus and its effectiveness on a cellular level. If you want to go over them with me, I'll be happy to go over them with you. Or just go to the Juice Plus website, or my Juice Plus website if you want, juiceplusdentist.com, and you can look at the studies. The studies are in real credible peer-reviewed journals and university studies that have been done all over the country. These are double-blind, placebo-controlled studies. So very, very neat to have that kind of a resource for us. So let's look at what happened with this particular patient. So one of our assistants is seeing the patient, and the report is the patient is using Sonicare and Hydrofloss once a day. The problem area is found. Recommended changes by the assistant suggest they use both twice daily. He's doing a good job, and I don't see a lot of buildup. And this, of course, goes into the chart. Next thing is the diet, and here's the diet. Patient says that he has a monster drink or sweet tea on occasion, but does not eat much more sugar than that. And, of course, our recommendation is stay away from sugar as much as possible. And then with regard to the supplements, patient states he's taking all the supplements directed, and our recommendation is to continue to use the supplements. And he may consider ordering more once you use them all. That's Juice Plus. Juice Plus comes with a, 3-month supply, 4-month supply?
It comes with a 4-month supply.
And then next visit, and assistance is really important. Every time you're in a progress note, or at least in our office, every time you're writing a progress note, it's so important that you write next visit, what's expected, because otherwise the front desk is scampering around trying to find out what the patient is scheduling next for, particularly if the patient doesn't schedule right away and calls 2 weeks later. If the patient can just look in the chart and look at progress notes, and the last progress note says next visit is such and such, then it saves your front desk a tremendous amount of time.
Yep, and also this is great because patient usually comes back 3 times or more for these visits, and since they're all the same questions all the time, we can just simply look back at those to say, well, last time, we were talking about this, or last time you stated you weren't doing this, and we can use those as comparisons to make sure that they're getting on the right track.
This is the Perioscope. This is the new Perioscope, and essentially it's a big, big, big computer screen. I hope you'll take a look at the Perioscope at one of the meetings. It was the AAP in San Diego, and I'm sure you can see it at other meetings as well. We found this to be a tremendous tool. for patient involvement, but more importantly for the hygienist to actually see everything that's growing on the root and get everything on the root off. It's technique sensitive. Certainly you have to be assiduous in getting into the root surface, but let me tell you, the amount of periodontal surgery that we do now as opposed to what I did 15 years ago before we got the periscope, it just pales by comparison. And this is the primary tool that we use, plus a very skilled hygienist. Primary tool that we use in order to control all chronic periodontitis, period. Okay, so now we look at the results. So this is just, last week or 2 weeks ago?
10/26, yeah.
Okay, now take a look at what's happened on tooth number 11. Take a look at all of these pockets. Take a look at the circumferential defect that we had on the lingual tooth number 18 and where it is now. Let's compare it to where it was before. Okay, so there the patient is on 510. Look at the defects. And that's where the patient is on 10/26. And this will stay under control as long as the patient doesn't become reinfected. Now, are there times that I'll run a second oral DNA test because I'm not quite satisfied with the results? Yes, there are. Am I having the patient use Vista, which is sodium hypochlorite twice a week, as Jorgen Sloss recommends? Yes, and do. Because we now have real good evidence that the herpes virus and cytomegalovirus can infect these pockets, and the fact these pockets are not just related to bacteria. So yes, we do that. If a patient doesn't work out well, what's the next step? If I've treated them antibacterially and they're still not doing well, and that just happened to me, by the way, today, then I'll prescribe Valtrex, and I'll have the patient back again in 2 or 3 weeks, and I'll probe again and see if we've gotten to the bottom of the problem. This is chronic disease with multifactorial reasons for the deterioration. We don't always get it right the first time. And as long as we explain that to the patient, there are 2 or 3 different causes of this disease, and we're going to take the most logical thing first, the most prevalent thing first, and treat you that way. And then if we need some fine-tuning, we may have some things to do later on down the line. The patient's very appreciative and very understanding. So now you see the difference. So I want to read you the success story that they wrote. And by the way, we encourage all of our patients to write success stories.
Yes, we do.
Particularly when they have success.
Yes, we do.
When I came to Dr. Sheldon's office, I had already seen 2 other dentists. I hadn't seen a dentist in 15 years. All I knew is that my girlfriend told me that my mouth smelled. I had some sensitivity in my upper right back teeth when I brushed. When I saw the first dentist did a deep cleaning on me, and then I had some cleanings afterwards. My gums were doing a little bit better after the deep cleaning, but my girlfriend still said that my breath was bad. It wasn't as bad as it was before, but it was still pretty bad. Finally, the dentist said that there wasn't any more that he could do and sent me to a specialist. When I went to the specialist, that doctor said that I needed to have my gums cut from ear to ear and said that I might even lose some teeth. I didn't like the idea of that. I didn't want to have my gums cut, and I didn't want the sensitivity that was associated with the cutting, so I was looking for another approach. I went on the internet and I saw Dr. Sheldon's website. There were some things on the website that connected with me. There was more of a scientific approach that I saw on the website, so I decided to make an appointment for another opinion. I talked with Dr. Sheldon on the phone. He told me a little bit about what we were going to be doing, and he did mention something about a test that we could do to see what bacteria is growing in my mouth. Once we had that test done, he can often get patients healthy without doing surgery. So I saw him, and he did the examination. He ran the oral DNA test, which was the test to determine what bacteria was there, and found that I needed an antibiotic. I took the antibiotic, and my mouth started to feel better. His hygienist, Rebecca, used the periscope and cleaned the roots. Now my gums are healed up. There are no pockets anywhere. I'll even admit that I've been slacking just a little bit in my home care, but I'm doing a lot better than I did. My teeth feel better. My girlfriend said my breath doesn't smell at all. Sometimes you just need to go and get different opinions before you find the one that connects. I am happy that I went to Dr. Shelton's office because what he did worked for me. How valuable is that?
Yes.
That can go in your booklet of success stories you have at your front desk. When a patient has a similar problem, you can have those success stories in your financial arrangements area with a smiling picture of the patient. If you need more success stories on your website, the more success stories, the better. You've got that. When a patient writes something like that to us, how likely is it then that the patient is willing to give a Google review that says exactly the same thing? And so the public relations goes up, not because we're faking anything, but because we're making our works well known to others. That's how we have 101 Google reviews right now, by doing exactly this. Word of mouth is great. But the best word of mouth that we have right now, besides word of mouth, is Google reviews. And we do everything we can to make sure those are up. A lot of patients come into us, as we've talked about before, as a result of these Google reviews. But more importantly is the success of treatment. And the patient that his mouth doesn't smell anymore, even if he's slacking a little bit. So that's our success story that we wanted to share with you. There are other ways in which you can treat the patient. The idea is that we're periodontists, we have opportunities of giving our patients all of the oral health and, frankly, have a good chance of improving their general health as well. So I hope you enjoyed this. Have a happy Thanksgiving.
Oh, yes.
We'll talk to you again in December.